Hello and welcome to Under the Magnifying Glass. This is one of a series of podcasts where we look under the magnifying glass surrounding health claims made for dietary supplements. I'm Andrea Lindsay, the Director of Operation Supplement Safety, or OPS. I'm a senior nutrition scientist with the Henry M. Jackson Foundation in support of the Consortium for Health and Military Performance, or CHAMP. CHAMP is a center of excellence at the Uniformed Services University. Today, I am very happy to be joined by our panelists, Dr. Gary Asher, Dr. Aisha Chilcote, and Dr. Amanda Corbett from the University of North Carolina at Chapel Hill. Gary is a professor of family medicine. Aisha is a naturopathic doctor and NIH T32 postdoctoral research fellow in the program on integrative medicine. And Amanda is an associate professor and assistant dean for the Doctor of Pharmacy program at UNC Eshelman School of Pharmacy. They all have many years of integrative health clinical expertise and have worked with patients who often ask questions about dietary supplements. I really enjoy teaming up with them on several initiatives, including this podcast on the topic of dietary supplements. We are discussing some basic questions you might be thinking about when considering using immune health supplements and how you could approach these questions and engage in conversations with your doctor, who can advise you best about using dietary supplements. Gary, Aisha, and Amanda, welcome. Thank you so much for contributing to our research project and for speaking with us today. So I'd like to start with Dr. Gary Asher. Gary, can you introduce yourself?
Sure, Andrea. Thanks for inviting us to join you. It's really nice to be here. As you mentioned, I practice family and emergency medicine, which I've been doing at UNC for about 2 decades. I'm also a researcher and educator at our School of Medicine and at our School of Public Health. One of my more interesting jobs has been creating and growing the integrative medicine services at our cancer hospital. And there we have our integrative medicine consultation clinic, which has been one of our biggest successes. It's where patients can come and talk with a licensed medical provider who's an expert in integrative medicine. One of the big topics, of course, during these visits is the use of dietary supplements and what place they might have with all of their other cancer treatments. So these kinds of discussions that you're talking about, this is something that I've been doing now for a pretty long time.
Well, thank you, Gary. And Dr. Chilcote, can you tell the audience a little bit about yourself?
Hello, everyone. As Andrea mentioned, I'm a naturopathic doctor, and I completed a 2-year residency at an integrative cancer hospital to provide patients with a holistic healthcare approach. The training I received helped me to consider the whole person, mind, and body, as well as the patient's family, past medical history, current medications, and lifestyle factors. And I do have extensive experience evaluating dietary supplement quality.
Thank you, Aisha. And Amanda, can you tell us a little bit about yourself?
Hi, everyone. It's really great to be here today. As Andrea already said, I'm a faculty member at the School of Pharmacy here at UNC. I've also been a licensed pharmacist, a pharmacologist, and an educator for over 20 years, where initially I did research and taught and cared for patients with infectious diseases and HIV. And then in around 2007, 2008, my personal journey in integrative medicine began mostly with mind body modalities and very quickly also became my career journey. I remind myself and my students often as well that the first medicine were indeed plants. And this has provided an opportunity to continue my career with a focus on integrative medicine and especially including dietary supplements and herbals.
Well, thank you again for your contributions to our project as you all bring a needed perspective to this conversation. I want to take a moment to mention our disclaimer. What we'll talk about today and throughout our series are my own opinions and do not reflect the official positions or policies of the Uniformed Services University, the U.S. Department of Defense, or the Henry M. Jackson Foundation. Any mention of trade names, commercial products, or organizations does not imply endorsement by the US government. So let's get into it. The reality is that thousands of dietary supplement products are on the market today that claim to support the immune system, and immune products alone are a multi-billion-dollar market. For example, here are a few of the claims consumers may encounter on a dietary supplement label. Support the body response to stress and fuel the immune system. Primes the immune system to protect the body against daily stressors and environmental challenges. Immune defense and daily immune boost. A recent Harris poll shows that since the COVID pandemic, 3 in 10 Americans have either initiated or increased their use of supplements, bringing the percentage of daily supplement users to more than 75% of the adult population. The poll showed that 2/3 of those who increased their use of supplements cited a desire to boost their overall immunity and protect themselves from COVID-19. People seem more health conscious and are aware of the value of self-care today more than ever before. So here's my first question for the panel. How would you advise patients who are interested in taking dietary supplements to support immune health? Gary, would you like to go first?
Sure, Andrea. First and foremost, I'd say talk to a provider trained in the use of dietary supplements. This might be your primary care doctor, but often primary care providers have little training in the safe and effective use of supplements. So, depending on your health history, you may be best off speaking with a dedicated integrative medicine specialist. An initial question to ask your provider may simply be to ask, what is their experience or comfort talking about dietary supplements? If this is not an area of expertise for them, they might have suggestions for local experts that they recommend. And if not, you might need to start looking around yourself. You might consider a clinical pharmacist or a local integrative medicine provider, or perhaps a licensed complementary medicine provider, such as a naturopathic physician.
That's such a great point. Thank you, Gary. I know that based on some of the questions we receive through our Ask the Expert portal, that people just don't know who to talk to. And sometimes a provider can also point them in the direction of a clinical registered dietitian as well. So Aisha, Amanda, do you have anything that you want to add to that?
Yeah, I mean, I'll just add that indeed patients do often ask, how do I actually find an integrative health provider? So one way I like to recommend is for patients to look for providers that have been trained in programs that are accredited by the ABOIM or the American Board of Integrative Medicine. Currently, MDs and DOs only can be board certified. However, many of the training programs, such as the fellowship I completed several years ago, is available to many different types of health professionals. That's just one way to find a provider that can work with patients that are taking or want to take dietary supplements for immune health. Aisha, do you have other suggestions?
Well, I would add that licensed naturopathic doctors are trained as primary care physicians in certain states, and generally they receive extensive training on integrative health and dietary supplements.
Okay, so once someone has found a provider, what comes next? Gary.
Well, I like to think about things in threes. So once someone picks a provider to visit, my top 3 list for what comes next is as follows. First comes number 1. Ready? Bring all of your supplements and medications to your visit. It's so important that the medical provider you're speaking with knows all of the pills you're taking. So some dietary supplements may have multiple ingredients, and providers really need to look at the label to know what's in the supplement and how much of that ingredient is in the product that they're taking. Next in my list, number 2, you ready for this? Bring all of your supplements and medications to your visit. And finally, number 3, you guessed it, bring all of your supplements and meds to the visit. All kidding aside, your provider can't really have an informed discussion with you if they don't know what you're taking. And it can be really hard to know what you're taking without seeing the actual product label. So it's really important to bring those bottles with you to your visit. Also, and I know this might sound a little basic, but if you want to have a conversation with your provider about supplements, make sure you're the one to start the conversation. Don't wait for your provider to bring it up because they just may never do it.
I'm so glad you brought up bringing the actual supplements in because sometimes it's more than just what's on the supplement facts label, it's the totality of the product. So that's so important. Aisha, anything you want to add?
Well, as a naturopathic doctor, I'm most concerned with the clinical picture that a patient presents with, and I'll make recommendations to a patient based on my clinical assessment and numerous factors like current symptoms, medical history, prescription medications, and or supplements that they are taking. All of those factors contribute to my holistic understanding about what is going on with the patient at that particular time. Since I'm only able to provide patients with supplement recommendations, not diagnosis or treatment, oftentimes I have a conversation with them about their medical history, prescription medications, and lifestyle choices prior to making any recommendation about dietary supplements. The reason for this is to help with evaluating safety and to prevent any potential interactions between other supplements and medications that they could be taking.
All really great points, Gary and Aisha both. And I would just add that if a dietary supplement is desired immediately or while patients are working on other approaches to their care, it must be a quality product. As we've mentioned, a dietary supplement that does not interact with the patient's prescription and over the counter medications is also important, and it does not have known harm or major side effects. So we do know that some patients that take medications, for example, for cancer, HIV, seizures, depression, anxiety, following an organ transplant, or for certain autoimmune conditions, and these are just to name a few, could have a higher risk for interactions with dietary supplements. So, like Gary said, they should always bring in all their supplements, and we should also know what other medications they're taking. And patients should consult with an informed provider if they're taking meds and desire to take dietary supplements.
Thank you, Amanda. So now let's talk more about some of the benefits and harms associated with dietary supplement use. Gary, do you want to start things off?
Well, once you find someone with appropriate expertise, the conversation about dietary supplements should really focus on the evidence for both benefit and harm. When talking about supplements, I like to divide them into groups. So there are those that may be safe or unsafe, and there are those that may be beneficial or not beneficial. So, for example, St. John's wort, this is a supplement that many folks have heard of, can be very helpful for folks with depression, but we need to take great care when recommending it since it can cause problems with so many prescription medications, making it unsafe to use in certain circumstances. So this one I categorize as beneficial, but potentially unsafe for some folks. Next is a key issue for patients is to understand how much risk they're willing to take regarding potential harms. Some patients might be willing to tolerate a small risk of harm with a supplement causing a problem with one of their medications, while other patients may be more concerned to make sure nothing will cause a problem for any of their treatments whatsoever. It's important for patients to understand their tolerance for these risks, and it's equally important for their medical providers to be able to help with these patients understanding what the risks may be. So the bottom line for me is it's important to have these conversations with trained professionals who can help you understand both the potential benefits and the potential harms. Aisha?
Well, in addition to what Gary said, I think it's also important to identify why you're wanting to take a dietary supplement. As Gary just mentioned, it is important for your medical provider to be able to help people to assess their risk. Personally, I do not encourage taking supplements purchased from most retail stores due to the inconsistent quality testing for many products sold there. Caution should be exercised when taking dietary supplements. The supplements that I recommend have received third party testing, which means that another company, other than the one who manufactured the product, tests it for its presence of contaminants like heavy metals, pesticides, and other chemical residues. Understanding how third party testing works is an important first step in being able to make better informed choices as a consumer about certain supplements or specific products. So it's really important to look for those seals on bottles.
Thank you for bringing up third-party certification, Aisha. That's a topic that we educate on across the DoD, specifically with our service members, and we educate on those companies that test for banned substances in sport as well. Amanda, anything you want to add to that?
Yeah, absolutely. So I would say that, most patients that I've worked with most likely do not understand third party testing, even though we all agree that this is really important. So this is really one reason why, at least, I really try to work with patients to minimize use of prescription or over the counter medications, including dietary supplements. So the goal is to use them appropriately. In other words, when they are safe and effective, and to not use any substance, whether prescription or not, unless it's really necessary. So going back to our immune health question, so people are often really interested in supporting their immune health. And from a clinical perspective, we interpret this as we help them to find a dietary supplement so they do not get sick. And when they do get sick, what can be done to help them get better or to get better quicker? The studies on dietary supplements to support the immune system, as is with many cases in herbal medicine, really just is a mixed bag. So, for example, echinacea has been shown in some studies to have a modest effect on helping study participants not develop upper respiratory tract infections, or those that we might call infections of the nose, sinuses, throat, and the windpipe. However, the data is mixed, and some studies do not show it to be helpful. There's really so many factors in considering whether or not data will show effectiveness. Just some of these factors are well-designed studies that use appropriate doses, use products that are made with the dose desired to be studied, as well as products that are free of contaminants or other substances that could interfere with the results of the studies.
Thank you, Amanda. Now it seems as though we should discuss things consumers can do to support immune health. Aisha.
Yes. So, one of my approaches is taking care of my own health or self care management. And it is to focus primarily on a healthy diet and lifestyle for optimal health and wellness. I think there can be benefit to supplementing with certain vitamins and minerals to support immune health if you have certain deficiencies. However, many products have excessive amounts of certain ingredients, which is a red flag. Or worse, some products may include a proprietary blend, does not detail how much of any particular ingredient is included, but rather how much of that blend as a whole is included in the product. So, this could be harmful to the extent if you are combining multiple products together and they both have proprietary blends, you don't know exactly how much of any one ingredient that you're taking, or if you're getting too much. So, in my opinion, my personal approach is to start by focusing on nutrition and physical activity. The benefits of having a well balanced diet filled with healthy fruits and vegetables can significantly enhance immune function. Food as medicine is often overlooked, but the bottom line is that the importance of a healthy diet with moderate exercise is vitally important to being able to boost the immune cells that support our body's natural defense system to ward off viruses and bacterial infections.
Thanks, Aisha. Those are excellent points. I completely agree. And unfortunately, there really is not a magic pill, which is often, something I feel like patients seek. But there's really not a magic pill that will make a person having a healthy immune system. It really starts from within. My students and colleagues all know my favorite organ per se is the gut. It houses the largest part of the immune system in the body. So keeping the gut healthy is really important for the immune system to be as healthy as possible to prevent infections and diseases, but also to be strong enough to treat any diseases a person might encounter. I also agree that supplementing with certain vitamins can be helpful. For example, what can be helpful for immune health is for patients to make sure that they have adequate levels of vitamin D. What is adequate is somewhat variable depending on the reason one is asking. However, in this case, for immune health, we know from at least a meta analysis that vitamin D supplementation reduced the risk of acute respiratory tract infections and protective effects were even larger in people that had lower vitamin D levels at the beginning, and less than 10, which is pretty low. So, what is also important is making sure the patient is working with a provider to monitor how much vitamin D they are taking and also what their levels would be when taking vitamin D. Because what we do know is that too much vitamin D can also cause side effects and can be dangerous.
Well, I'd bring this back around to some of the things that Aisha was just talking about. There are many healthcare approaches for optimizing overall health and immune health, and dietary supplements aren't actually at the top of my list of things to suggest. And here's why. There's just not a lot of great studies out there to suggest specific dietary supplements can prevent or treat infections. But there are a variety of simple healthcare practices that do have good supporting evidence to improve health, including immune health. So, for example, daily exercise, right? Exercise has the power to improve so many aspects related to immune health, including our sleep, our mood, immune function, just to name a few. If exercise could be turned into a pill, like that magic pill that Amanda just talked about, it would quickly become the highest selling blockbuster drug of all time. And that's no joke. If I could only make a single recommendation to people, it'd be for 20 to 30 minutes of daily exercise, moderate daily exercise, like a brisk walk, enough to begin to get yourself just a little sweaty. If you've got more time to exercise and can tolerate higher intensity exercise, more power to you. But any simple daily exercise, even walking, is far better than no exercise at all. Second, if you smoke, consider cutting back, or better yet, just stopping. I've lost count of how many important healthcare processes smoking affects and how many diseases it can cause. For smokers, this might be the number one thing you can do to improve your overall health and immune function. If you're ready to consider quitting, talk with your healthcare provider about strategies to quit. And importantly, talk about strategies to stay quit. Next on the list, I'd say comes diet, as Aisha already mentioned. And for this, there are a few simple elements to consider. It's so important to eat a well-balanced diet filled with plenty of fresh fruits and vegetables, unprocessed foods, and little refined sugar. Sugar especially is known to decrease immune function, so cutting down or just taking it out of your diet as much as you can go a long way towards better immune health. Alcohol too can decrease immune function as well as impair mood and sleep, both associated with immune health. So decreasing alcohol intake is another important dietary intervention that can bolster immune health. I've mentioned sleep now a couple times, and I know good quality sleep is an important factor for maintaining healthy immune function. The evaluation of sleep problems takes time and careful attention. And if you regularly have problems falling asleep or staying asleep, I'd suggest having a discussion with your care provider to come up with a good sleep plan. So there are a number of other health practices that I might consider as well, and maybe towards the bottom of that list, that's probably where I would put dietary supplements.
Well, I completely agree with all of you, and I wish we had more time to dig into some of this even more. Maybe we'll just have to come back for another podcast. So now, what's the bluff or bottom line up front? What would be your take-home message to a patient who is seeking immune health and wants to turn to dietary supplements as the answer? Aisha.
Yes. So briefly, I just want to promote that our personal choices can affect our immune health. I usually share with patients that it may not always be about what we are taking, but rather our individual choices. So, working to create balance and thinking from a different perspective is the first step towards the desired change to support our immune health. As Gary mentioned, it's a journey to start developing better lifestyle habits. But this is a requirement if we are seriously committed to developing a healthy lifestyle.
Well, my bottom line, I gotta say, dietary supplements are just not my go-to choice for immune health. I want to talk to folks about other evidence-based practices that can improve overall and immune health that I mentioned earlier, like exercise, diet, smoking and alcohol intake, and sleep. I know I sound like a broken record, but that's my bottom line.
All great things, Gary and Aisha both. I also agree dietary supplements, again, are not my number one recommendation for supporting immune health. However, we know many patients do desire this, and that's what we're talking about here. So, if a patient really, really does desire the use of a dietary supplement, would be to use them in addition to all the great lifestyle recommendations that we've mentioned. And they should work with a knowledgeable integrative health provider who can help them with selecting the best dietary supplement that is both safe and effective. As a matter of fact, there's a great tool by the Operation Supplement Safety. It's called the Operation Supplement Safety Scorecard, which provides consumers and providers both a tool they can use to begin thinking about whether a dietary supplement product they would like to take could be safe for them. Ideally, this tool would be used together with a provider who understands how to safely and effectively use dietary supplements, but it can for sure help consumers think about the right questions they should ask themselves when they're considering taking a dietary supplement or not.
Well, I want to thank you all, as hearing from you from your respective places in your professions provides valuable information for all consumers. This is very important information. It's always great to team up with you all with a collective goal to make sure consumers know how to choose safe supplements. For additional information and resources, go to ops.org or opss.org, and also the Office of Dietary Supplements at the National Institutes of Health. They have great fact sheets on vitamins, minerals, botanicals, and other ingredients, as well as a COVID-19 fact sheet. And as always, feel free to submit and ask the expert question to our ops.org portal if you have questions related to dietary supplements. You will receive an evidence-based answer within 5 to 8 business days. Thank you for tuning in to Under the Magnifying Glass. Until next time, have a great week.